This is a response to my friend Rob RC62. He was talking about the upcoming healthcare plan and healthcare plans in general. Now, I'll tell you about my basic background and philosophy is, you probably see in the background there's all kinds of snow. It's like a high of 5 degrees today. I think it's about 2 degrees right now. Just a little side note. I'm basically a capitalist, and if I could pick a plan to fix the healthcare system, nobody would probably agree to it, but my plan would be to actually treat the healthcare system the same way you deal with other types of insurance, because health insurance, they call it that, but it sure isn't insurance. It's managed care. You don't buy insurance for your home and then have your insurance for your home pay for every repair. If you have a leaky faucet, something like that, you don't have it pay for your ordinary repairs. And if you expected your homeowner's insurance to pay for ordinary repairs, you would be paying a small fortune. You would probably be paying 10, 20, 30 times what you're paying now for your homeowner's insurance. I think mine runs $400 something a year, which is pretty reasonable, but they're only going to protect me if I have some kind of disaster happens or a tree crashes through my roof or something like that. So I would actually switch to a capitalistic system, and you would have real healthcare insurance that would pay for a disastrous expense, but the ongoing stuff would be out of pocket. And I bet you real quickly you would see the prices of ordinary medical care drop when everybody has to actually pay it out of their pocket. All of a sudden you get competition, you get all kinds of creative ways that they're going to make things happen to save you money when it's actually out of pocket. You don't just go into any doctor's office you choose, no matter what the expense, and your insurance company's going to pick it up. But anyway, that's just theoretical. I'm also a pragmatist too. Besides being a capitalist, I'm a pragmatist, and I know that would never happen. It would be, the adjustment would be horrible. The first year or two going through that, as prices would adjust, it would be great at the end, but nobody'd want to go through the adjustment period. So the option isn't to stay. I agree with what Rob said. The option isn't, we can't stay with the way it is right now. It is so broke that I'm even thinking too, and I hate to say this as a capitalist, but I'm actually saying it's so broke that if we went to a Medicare type of system or even a government health system, it probably wouldn't be any worse than what we had. And at least then there would be some control on the expenses going up. Now, I have just basically a disaster policy myself. My health insurance per se does not pay for any ordinary expenses. If I'm hospitalized, after I pay a tremendous deductible, then it'll pay 80-20 until I reach several $1,000s of out-of-pocket expense, and then it'll actually start paying something significant. So what I'm forced to do is go and bargain with my healthcare providers, which they're willing to do, believe it or not, because they bargain with the insurance companies and reduce their prices. They will bargain with you too, and if they don't, walk down the street to the next person. But that's what I have to deal with. But it's so broke right now that we do need some kind of different kind of system, no matter what it would be. Now, do I think the systems being proposed right now are a very good idea? No, they don't seem to be any. They seem to be even worse, at least the ones that are proposed on paper, because when they give a new version of the healthcare system, I actually go on different websites and I actually read the details of the plan. Yeah, it's boring reading, but you find out what actually you're getting yourself into and what your senators and representatives are actually voting for. Now, the last plan before this recent one, I'll tell you about that, where they were just before they came up with this newer plan, but the last one of a couple of months ago, what they considered affordable health care for those people that could not afford affordable health care. This was the government's idea. First of all, they would force you to buy it, which I'm not too keen on that idea of forcing people to buy anything. I mean, we're in a free society, we shouldn't be. But they are talking about it according to this plan, and I read it in 4 different websites, that an average family that's a husband and wife and 1 kid making around $44,000 a year would pretty much be forced to pay $5,600 per year in premiums. That's about $500 a month. Or the government would be considered you breaking the law, and they would start fining you for it. Now, there's been a recent Senate plan just come out now to where they're going to let people 55 and up buy into Medicare. They can't afford insurance, or are left without insurance because they're unemployed, not able to change jobs, because at their age, if a factory lays off or something like that, there just may not be very many opportunities at that age for somebody to hire you. Well, guess what the buy-in is on that? This recent plan that Obama himself was praising as being such a great plan. I cannot believe these Democrats, supposedly for the working class, for the poor people, they're just absolute loons. I mean, and I say that, used to be a Democrat myself. I was a Democrat. That was the only party I ever belonged to. But I think by the middle 70s, I was sick of that and I quit. Now, I didn't become a Republican because I'm not really super fond of them either. I became an independent. But these Democrats, I tell you what, they lie twice as much, I think. Recently, I'd say they lie twice as much as the Republicans do to you. And not that any politicians, I mean, I think most of the time are liars. But get this, the recent plan now for seniors to buy into Medicare at 55 is going to run an average price per person of $630 per month. Now, I was thinking more along the lines of, I guess right now it's running for people in the age range, 65? I think this starts running $100 a month. So I thought, okay, for people that are buying in at 55, maybe $200 a month, that seems kind of reasonable. Let the younger people buy in at twice the cost. But no, not $200. Not even $400, $630. Now, if you're a senior citizen, you've lost your job because the factory shut down, you're struggling to make ends meet, where are you going to come up with $630 to pay for this newest recent plan? So, basically, I don't know. As a second place, I mean, it's hard to figure out anything. I mean, we're gonna be dealing with rationing of healthcare anyway. We have, if people don't realize it, you have for over 15 years anyway. Try belonging to a company that has an HMO that doesn't want to pay for any kind of procedure or any expensive procedure. They're going to call it experimental, so they're not going to pay it. So they've got 10 ways to Sunday to not pay the bills and leave you stuck with it. So if you think it isn't rationed healthcare already, it's been happening that way for 15 years, and that's going to get worse. So my idea would be something like either a national sales tax, maybe put a 1% national sales tax on everything to pay for it, or I don't know, don't have a better idea than that just off the top of my head. But basically, if you're going to really solve it and not lie to the people and mislead the people, just say, hey, this is the way we're going to pay for it, national sales tax or some other way, an extra 1% of federal income tax, and just say, give everybody a card. Everybody that's a United States citizen is entitled to health care and health coverage. But I don't even see anything close to that. I mean, they're so often la-la land with these stupid plans that are going to make criminals out of poor people that can't afford insurance by increasing a fine year after year and then calling affordable health care like $600 and more a month. I mean, it's just absolutely stupidity, ridiculousness on top of ridiculousness. So that's about the best plan I could put forward. But basically, everything that I'm seeing, if you go and actually read the details, and I guarantee you, I bet you a lot of the senators and representatives didn't go on the web pages and actually read copies of the actual plan itself to see what they're voting for. They just listened to all these people in Congress and people in the Senate and Obama himself saying, oh, affordable health care coverage for the poor. Well, it ain't real, guys. There is nothing real about it. Don't think it's real. Don't think they're doing anything but just lying and misleading you. And making criminals out of us besides anyway for not being able. You're going to be a criminal because you're poor and you can't afford health care. So that's kind of my response to RC62 and a little bit of my rant too about the political system. But okay, take care, guys. I'll talk to you later.